Quick note, this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Am I going through menopause? It's one of the most common questions women ask their doctors, and one of the hardest to answer without the right information. You might be experiencing hot flashes, sleep problems, or mood changes, but here's what most people don't realize. Your symptoms alone aren't enough. According to Mayo Clinic, the only way to know what's actually happening in your body is through hormone testing. Today, we're breaking down exactly which tests matter, what they measure, and what those numbers actually mean. The NIH defines menopause as 12 consecutive months without a period. But before that happens, sometimes years before, your body goes through perimenopause. During this time, your ovaries produce less and less estrogen and progesterone. This isn't a sudden cliff. It's a gradual decline over years. Medline Plus notes that this transition typically begins in the mid-40s and can last anywhere from 4 to 10 years. Understanding this process is crucial because your hormone levels fluctuate constantly during this phase. You might wonder, why test at all if I'm just experiencing normal aging? Because according to the Cleveland Clinic, not every symptom is menopause-related. A racing heart might be thyroid dysfunction. Exhaustion could be anemia. Mood changes might signal depression. Hormone testing helps separate what's actually happening from what we assume is happening. Testing also gives you and your doctor a baseline, something to measure against in the future. It's like having a map instead of just guessing which direction to go. FSH, follicle-stimulating hormone, is usually the first stop. Mayo Clinic uses it as the primary marker because FSH rises dramatically as your ovaries decline. In your reproductive years, normal FSH is below 10 MIU/mL. But as you approach menopause, it climbs. If you're in perimenopause, you might see levels between 25 and 100. After menopause, confirmed by 12 months without a period, FSH typically stays above 30. But here's the catch. FSH fluctuates day to day, so a single test might not tell the whole story. Estrogen and progesterone are the hormones everyone talks about. And yes, they drop during menopause. But according to the NIH, these are trickier to test because they vary wildly throughout the cycle, and even minute to minute. This is why doctors often skip testing them individually and instead rely on FSH. However, if you're on hormone therapy or need specific clinical information, your doctor might order estradiol levels. Medline Plus notes that typical reproductive age estradiol ranges from 24 to 400 pg/ml, but these numbers shift constantly. Here's what gets missed in menopause conversations. Your thyroid. The Cleveland Clinic reports that thyroid dysfunction and menopause symptoms overlap almost completely. Hot flashes, fatigue, mood swings. They're all thyroid symptoms too. So any good workup includes TSH testing. Also, check your iron levels. The NIH notes that perimenopause sometimes brings heavy bleeding, which depletes iron and causes exhaustion that has nothing to do with hormones. Blood work should also screen for B12 and vitamin D, common deficiencies that mimic menopause symptoms. This might be the most important part. Reference ranges are wide because every woman's body is different. Medline Plus publishes standard ranges, but your normal depends on your age, cycle phase, and individual baseline. A test result outside the published range doesn't automatically mean something's wrong. It means your number differs from the average. This is why test interpretation with a doctor matters. You're not comparing your numbers to some absolute truth. You're comparing them to your own history and to general guidelines. Context changes everything. Timing matters. If you still have a cycle, Many doctors recommend testing during your follicular phase, the first half of your cycle, for the most reliable FSH reading. Come fasted if your doctor requests it. Bring a list of medications and supplements because some affect hormone levels. According to Mayo Clinic, your doctor might test once or recommend repeating tests weeks later, especially if FSH levels sit in that gray zone. Be prepared. Testing is just the beginning of the conversation, not the end. Test results in hand, the real conversation begins. Are you actually in perimenopause? Do your symptoms match your hormone levels? Should you discuss hormone therapy, lifestyle changes, or both? According to the NIH, every woman's treatment path is different, and that's intentional. Some choose hormone therapy, others manage symptoms with lifestyle adjustments. Some do both. Your results are a conversation starter with your doctor, not a prescription written in stone. This is where your agency matters. Understanding menopause means understanding your body. These hormone tests give you real data instead of guessing. Take this information to your doctor, ask questions, discuss your specific situation, and make decisions that align with your health goals. We've linked a full resource guide below with test reference ranges, what to ask your doctor, and citations from Mayo Clinic, the NIH, Medline Plus, and the Cleveland Clinic. Click that link in the description, bookmark it, and share it with anyone navigating this transition. What type of health tests are you interested in? Comment below, and we will make a video about it.